Okay, what is tonic contraction? Tonic contraction is sustained partial contraction of some of the skeletal muscles in response to stretch receptors is called tone or tonic contractions. What is a refractory period? Rest period that the muscle takes to rejuvenate. What is isotonic? Having the same tension, tone, or pressure. Muscle contraction in which tension developed is less than resistance of load. Therefore, the muscle shortens. What is isometric contraction? It is a contraction of the muscle in which shortening of the muscle is prevented. Tension is developed and does not result in body movement. Give a description of vertebrae column. The vertebrae column is a flexible column formed of a series of bones called vertebrae, which form a strong pillar of strong support of the cranium and trunk. Name the bones in the lower extremities: pelvic, femur, patella, tibia, fibula, the tarsus, metatarsus, and the phalanges. What are the 6 classes of bones when classified by shapes? Flat, long, short, irregular, sutural, and sinusoid. Sesamoid. Give an example of a flat, long, short, and irregular bone. A flat bone is known as the bones in your skull. The short bones are recognized as the tarsals and the carpals in your hand. The long bone is known as the femur, which is inside of your leg. The irregular bone is an example of the vertebrae, which is in your back. Is acupuncture a modified version of acupuncture? Yes, as it substitutes pressure for needle insertions. Ayurveda is a system of health and medicine, where this was originally developed in India. Define anatomy, physiology, and pathology. Anatomy deals with Anatomy deals with the gross structure of the body, the gross structure of the body. Okay, the anatomy deals with the gross structure of the body. Physiology is concerned with the normal functions performed by the various cells, tissues, the organs, and the systems in the body. Pathology is the study of the nature and causes of diseases, which involves changes in the structure and function. Now, give a detailed description of a bone. A bone is the hardest connective tissue that forms the framework of the body. A bone gives shape to a support the body. They also serve as a storage place for mineral salts and play an important role in formation of blood cells. Bones also protect some vital organs and give points of attachment for muscles. Chronic illness is defined as what? Chronic illness is defined as a disease, an injury, or a syndrome that shows no improvement or slow improvement. Name the 2 parts of the head. The 2 parts of the head is the cranium and the face. Name 3 parts of the trunk. The 3 parts of the trunk is the chest, the neck, the upper abdomen, which is the largest bone of the forearm bones. The largest bone of the 2 forearm bones would be the ulna. Then the bones in the cranium. The bones in the cranium is the occipital, parietal, frontal, temporal, ethmoid, symphonoid. What are the 4 main purposes that bones serve in the body? Okay, it gives shape to the body. It strengthens the body. It stores calcium, and it makes red and white corpuscles. How many pairs of ribs are there, and where are they located? So there are 12 ribs. The first 7 pair are attached in the front of the body via cartilage to the long, flat breastbone. That's the first 7, or known as the sternum. So the first 7 is connected to the sternum. These ribs are called the true ribs. The next 3 pair of ribs are called the false ribs. They do not attach to the sternum. They are connected by cartilage to the rib above them. The lower 2 pair of the ribs that do not attach in the front are called floating ribs. The function of the ribs is to give shape to the chest and to support and to protect the body's major organs, such as the heart and the lungs. The rib cage also provides attachment points for connective tissues to help hold organs in place. Where is the innominate bone? And what are the 3 parts of it? The innominate bone is a pelvic girdle, and the 3 parts of it are the ilium, the ischium, and the pubis. The ilium, ischium, and the pubis. What is the longest and largest bone of the upper extremity? Longest and largest bone of the upper extremity is the humerus. Name the bone in the wrist, in the hand, and in the fingers. Okay, so you got the carpals are the wrist bones. That's the wrist bones. Metacarpals are the bones of the hand. The phalanges are the bones of the fingers, the finger bones. What is the name of the largest bone in the lower limb? That would be the femur. Femur. What are the three arches of the foot called? Three arches of the foot is the transverse arch, the medial longitude arch, and the lateral longitude arch. So that's transverse arch, the medial longitude arch, and the lateral longitude arch. How many bones are in the skull, including the face? How many are immovable? There are a total of 22 total bones in the skull, including 8 of them are cranium, 14 of them are part of the face. Okay, and only one of the bone is one bone is movable, and that's the jawbone. There are 6 bones inside of the ear. Okay.